letter discussion. So what we're going to do today is learn some informal and casual words, right, that you are going to use in most of your letter writing. And along with that, we'd be doing the word functions of comma when we're going to use comma, because this is one of the most annoying thing to us medical students. And we'd also be learning about what medical terminologies can we use, right? What medical terms can we use? We'd be doing capitalization, how, right? And then at the end, we'd also be learning some difficult words, right? Difficult words which are to be learned by you for your letter writing, right? So first, let's start with the informal and casual words, right? So I'm going to give you a bunch of, my voice is not clear. How about now? Is it clear now? Is it better now? Is my voice clear now? Okay. All right, Dr. Simon, thank you for that. Okay, so first let's start with I'm going to give you some words, and I'll be asked or not. But before that, I want to tell you that, we are always just worried about, right? Like, what kind of connectors can we use in our letters? So I'm just going to give you some words which you are forbidden to use. All right, if you were taking IELTS, if you were taking TOEFL, you might have used these words, but in OET, they actually hate when you use these words. These are connectors, right? Furthermore, moreover, right? Hence, thus, right? These are certain words that you should never ever use in your letter writing. All right, now, one thing is that you guys always want to know that how and where you should use connectors, right? What you should know that when you write your letter, it should be in the past tense, right? In passive form, right? Past tense, passive form, and it should be simple. Simple in a sense that you should be able to communicate clearly, right? Any wordings or any sentences that confuse you would confuse the examiner, right? So as Newton has said, or maybe Einstein has said, that if there is something that you don't understand, you would not be able to make someone else understand that, right? So try to make sure that whatever you write, you understand it, because if you don't understand it, there are 110% chances that the examiner doesn't understand it, and if so, they would not give you marks. All right, so your letter is supposed to be in the past tense, in the passive tense, and it should be simple and clear. Now, there are certain students who either overuse the connectors or they don't use them at all, right? So there is supposed to be a balance in there, and that is, you would be using connectors when you're moving from one category to another, right? For example, if you are writing sign and symptoms, right, you're writing the clinical features, right? You're writing the clinical features, and from clinical features you move to the examination, right? And there's a contrast in between it, you would use however. This is one of the connectors, right? So anytime you're moving from one category to another, you use a connector. If you're moving from examination to lab reports, this is where you use a connector. If you're moving from lab reports to medicine, that's when you use a connector, right? What connectors do is that they try to bring a flow to the body of your letter, right? They're trying to build a flow. They're trying to make sure that two categories that are not similar, they somehow connect, right? So they connect the bits of information, right? As we write the letters, as we go move forward, we'd understand how to actually use the connectors. But for now, what you have to know is that furthermore, moreover, hence, thus, these are some connectors that you never, ever, ever use in your letter writing. Is this clear so far? Any questions at all?
Yes, no problem.
Yes. No questions? All right, let me move forward. So now we're going to learn some words which are casual and formal, right? So in your letter writing, right, in your English OET English exam, right, when you be speaking, you can use casual words, right? You can be casual. You can say yes. You can say yeah. I don't recommend it, but you can be casual. However, when you're writing your letter, I told you you're not supposed to use contractors, right? You're not going to use contractions, right? Like you won't be saying doesn't, you won't be saying won't, right? You won't be saying yeah, you won't be saying yeah, right? This is informal, right? You guys understand what informal is. Now I'm going to share with you a screen, right? I'm going to open this file, and if you want to okay, let me do something. So it's still not clear. Okay, so I would want you to open page 15 till I resolve this issue of my voice. Is it clear now? Is it better now?
Yes, much better.
Okay, that's great. Thank you. So this on your screens, you can see this is what we're doing right now. It's informal and casual expressions, right? So they say that in spoken English, these expressions are used in the formal letter writing as well, but there are certain terms that you would avoid using, right? For example, here it's written asks for, right? So for example, there's a patient and they have infertility issue, and you are their GP and they want you to write a request so that they can go to an infertility hospital, right? So you'd say the patient asked for a referral. You never say that. You'd say the patient requested for a referral. That is formal, right? Asked for is casual, right? It's informal. So if the patient's saying that they have pain, you would not be saying the patient said he had pain. You'd say the patient stated. They're very obvious. I'm just telling you and giving you some examples, right? These things are very, very obvious, but I'm just giving you examples so that it's clear for you. And if you guys have any questions, any sentences that come up in your head, you can always ask, right? So the patient said he has pain. You would not be saying the patient said he has pain. You'd be saying the patient stated he had pain. The patient reported he had pain. The patient presented with pain, right? Okay, it's still breaking. Dr. Kiran, can you reconnect? Is this the same with all of you that's still breaking? The voice is still breaking?
I think there is no problem, but I don't
Okay. Dr.
resolve
Kiran,
it.
yeah. Okay. Thank you, Dr. Aisha. Dr. Kiran, please. Okay, thank you. Right. So, okay. Now there is another word like, right? So if I say her medicine, right, I'm saying her medicine includes insulin, right? It includes metformin, it includes glipizide, right? So if I write a sentence and I'm saying her medicine includes things like, right? You would not, first of all, when you say like, it is open to many interpretations, right? Like can be like, right? It could be many things in there. So don't write or don't say things even in your speaking which are unclear, right? Which have many meanings. For example, in your speaking, you're not supposed to say whatever or something or things, right? You have to be very direct, very clear. Try not to waste your time. Try not to waste your words, right? So when you use the word like, it's very vague. Instead of that, you would say her medicine include the following, right? So include is more formal. Is this clear? I mean, you can just straight away read the file. You can straight away look at the words. But if I give you example, that becomes more clear, right? One more thing is think, right? So when you're ending your letter, right? You're ending your letter. Okay, just split it for you. Okay, so now you are ending the letter. Okay, so now you're ending the letter, right? You're ending the letter and you're saying, I think she needs help. Is this a good sentence? I think she needs help. Is this good?
No, we should use
How?
I believe.
Okay. I believe, right? That is more formal. I believe, right? Or in my opinion, right? Or in my opinion, right? What we're
Yes.
trying to do here is we're trying to be more professional. Okay? We're trying to be very professional in here. The next word is get, right? The next word is get. So I'm saying that her condition is getting worse, right? Her condition is getting worse. Getting worse. How would you substitute this word? Because getting is informal, right? We don't think of it as informal, but it is. Her condition is getting worse. How would you substitute it?
Her condition has become worse.
Become, right? So the word here is become, right? Instead of get, you'd be saying become. Okay, so what's the next word here? The next word is got. Again, for got, you'd be saying become, right? Or became for get, become for got, right? Received. Okay, sorry, that's for get and got over there, right? So the next one is like again, you see for get and got, you can substitute. For example, there is this sentence over here. She got COVID. She has got COVID. How would you substitute it? What word would you use here? Because I'm saying got is not to be used in the letter, it's informal, right? So what would you say? She has got COVID, unfortunately. Yes, Dr. Isha, Dr. Saima, Dr. Mehtab, Dr. Kiran, Dr. Zishan. Are you guys there?
Yes, I can hear, but I don't know.
Ah, you can try. That's all right, Dr. Isha. Do try it. I mean, what would you say? You're a doctor. I'm sure you see thousands of COVID patients. I mean, you're working in you're studying in the hospital as well. So she has got COVID. What's another way of saying it? More formal.
She received, we can say like that.
She
Received, she received, or
received COVID. All right. For example, I say this patient got COVID, and I'm trying to be a little more formal. How would I say it?
She has infected from
Yeah,
COVID.
she's infected with COVID. She's infected with COVID. The whole idea is that got is not to be used, right? All right. Okay. If I say she got immunization, immunization for tetanus, how would you substitute this word? Because this is what your brain's telling you that you're going to write about the immunization status and you might be using got, but I'm telling you got is informal, right? It's one of the words that you're not supposed to use. Yes, so what would you say here instead of got?
she vaccinated for tetanus.
Okay, she vaccinated for tetanus or she received immunization for tetanus, right? She received immunization, okay? She received. That is one word here, right? She received immunization for tetanus, right? She has got her drugs, she has received her drugs, right? So these are the words. What I'm trying to simply say here is that got and get are not to be used in your letter. They are informal words. All right, any questions? Do you guys understand it? Do you have any more questions? Okay, should we move forward? She was immunized is good. She was immunized, but my sentence was different. So in accordance to that sentence, right? We're not supposed to change sentences um, if the case be so, right? So one more sentence. Her fluid intake is mostly consisted constituted of juices, right? I hope that's the right sentence. Like mango, right? Orange, etc. Now, how would you correct this sentence and what is wrong in here? Her fluid intake is mostly constituted of juices like mango, orange, etc. Just think of it as the list going on, right? This is not wrong, but something in the sentence is wrong.
We would replace like with such
Like
as.
with such as, right? Such as, right? Or instead of such as, you could say includes, right? Her fluid intake is mostly constituted of juices, which include mango, orange, etc. Right? So such as is also not to be used. Is this clear? Okay, clear?
Yes,
Yes.
Okay. So there is, all right. So there is another word, and that is so. Okay, so I requested her for a review appointment. Is this sentence correct?
We can use therefore instead of so. So sounds casual.
Okay, Dr. Icha, what do you think?
And I think also we should use something else instead of so. For example,
Yeah.
and as a result, that's not true, and because of this also not true.
Yeah,
I
like
think
what
as a
they're trying.
result,
Please continue. Yes, continue.
I think as a result maybe much better. As a result, I
As a
requested.
result, how many words are as a result? Instead of
Yeah,
saying as a result, whenever you have to say as a result, say consequently.
consequently, yes,
Right?
consequently.
Much better word. But it was good, right? Consequently, therefore, or so. So you're not going to say so, right? You're not going to say so. That's the whole idea of me asking you, right? So there is no word so that you'd be using, right? So one more word, I guess, and that is okay. She, right? All my patients are female. So she was very upset. She was very upset. Is this a good sentence? A formal one? Are there any problems in it? She was very upset. I mean, is it correct or incorrect? Does it seem fine? If it seems fine, you can say it seems fine.
I think very is true in here because as far as I know, very is formal, no problem. But
Yes, it
maybe
is.
upset, we can change the upset.
No, no, upset is fine as well. I'm just saying if you guys do use your brains, right? You're not supposed to say yes to everything, okay? So this is a correct sentence. This is not incorrect, right? Sometimes I'll be confusing you by giving the right thing, right? So that's what happens sometimes. You see, what I'm trying to do here is play as your subconscious, right? Because subconscious makes you doubt, right? Even when you're going to take your exams, be it lab, USMLE, etc., you'd be having questions in here. That'll be the same thing in your letter. You'd be writing a sentence, and then after a minute, you'd be like, oh, maybe this is wrong. So you have to have a firm belief in what you said for the first time, right? So that was a correct sentence. Okay, Dr. Icha. Moving on. I advised her about weight loss. Is this a correct sentence? I advised her about weight loss.
Seems correct.
Seems correct, but there is one word in here that I'm giving you a hint, is informal.
We can use for instead of about.
Okay. I advised her for weight loss.
Or regarding, I don't know.
Regarding, that's a good word, regarding. All right, one little trick here is that every time you're going to use advice, use regarding with it, right? Because that just makes life easier, right? Because you don't have to remember a bunch of words. Every time you're going to advise or write the word advice, and if you think that it's befitting, with advised, use regarding, right? Advise regarding, because you'd be using it a lot of time, right? So this is a tip in here that every time you're going to use advise, use regarding with it, right? She was advised regarding smoking cessation. She was advised to lose weight. She was advised to take her medicine on time, etc., etc., etc. Right? She was advised regarding. All right. Okay, Claire. Okay.
Yes.
So thanks for seeing my patient. Is it correct?
We will use thank you, the full form.
Thank you. Right? We're going to
Yes.
use right. No contractions. No contractions. That's the easy trap. Right? No contractions. Thank you for seeing my patient is correct. Okay. Now there are two sentences that I'll be writing.
Will we use my patient there?
Thank you for seeing my patient. You can say that, even though I wouldn't recommend it. You could say thank you for seeing and take the name of the person. Thank you for seeing the name of the person. All right?
Okay.
Because when you're going to even do speaking, I recommend that you take the names of patient, right? Rather than calling them the patient, because then it feels so subjective, right? Like you're trying to subjectify them. even though they are your subject, but they're also humans, right? So it's better to take the first name basis in. All right. Okay.
Okay.
Should we move
Yes.
forward?
Yes.
Okay. So no, instead of so, but I advised her regarding smoking cessation. All right, that's your first sentence. The second one is, however, I advised her regarding the same sentence regarding smoking cessation. Okay, that's your second sentence. The third one is, she was reluctant but agreed to my suggestion. How do you write it? Suggestion. Three sentences. The first one is, I just wanted to know if it's correct, it's formal or it's informal, but I advised her regarding something, smoking cessation, right? But I advised her regarding smoking cessation. So is it correct sentence? Is it formal or is it informal? Dr. Isher.
I think, and we can use something else instead of but.
Something else instead of but. All right. Dr. Zishan.
Yes. We can use therefore.
Therefore. Okay, you're saying we should use therefore. Dr. Kiran.
We can use however.
However, all right. What I'm trying to ask here is this is a correct sentence and it's informal, right? That's what you agree with. That the only problem here is with the but, right? Yeah.
Yeah.
Okay. So therefore, I advise her regarding smoking cessation, or however, I advise her regarding smoking cessation, depending on what kind of sentence it is. But what you're trying to say here is that but here is incorrect. All right. So you guys are right. Now moving to the next sentence. However, I advise her regarding smoking cessation. Is this this is correct? This is formal, informal?
This is formal, I think.
This is a correct sentence. Everybody agrees? Dr.
Yes.
Kiran, Dr. Saima,
Yes.
Dr. Mehta, Dr. Isha, Dr. Zishan. All
Yes.
right, the next one. She was reluctant but agreed to my suggestion. Is this formal? Should we use but here or not?
I think we can use in here, but
Okay. Yes, Dr. Kiran, what do you think?
We can use however.
Okay, right. Dr. Saima, what do you think?
Maybe but should not be here.
Right. Okay, what else should be here?
Maybe however, she was reluctant,
All right.
however,
Dr.
agreed
Zishan.
to my suggestion.
Oh, all right. Thank you, Dr. Saima. Dr. Zishan, what do you say?
Yes, she was reluctant. We would use however she agreed.
Okay. All right. Okay, Dr. Mehta, are you there?
Yes, ma'am.
Okay, maybe she is. Okay, so what would you use here instead of but, or can we use but in here?
I think we can use, but she was reluctant but agreed to my suggestion.
Right. So the thing here is that if you're using, you see, you can use however instead of but, right? The substitution for how but is however, right? That's the thing. But the thing is that you cannot use but in the beginning. The but you can use is in the middle of the sentence, right? So in the middle of the sentence, but is not a problem. But in the beginning of the sentence, they don't like it. They find it informal, right? Is this clear? That in the beginning of the sentence, you're not supposed to use but in the middle of the sentences, you can use but and it's allowed. It is formal. Clear? Should we move forward?
yes.
Yes.
Okay.
Okay, any questions so far? Okay, so we did this such as don't, do not. You guys know that. So should be transferred to any other words. A bit would be slightly, right? We're trying to use a little a more forward, formal thing. Okay, now here is the word. Here, the voice has echo. Voice has echo. Okay, is this the same with everyone? I'm hoping it isn't. Okay, Dr. Saima, I would try to talk slow then. All right, so kid. The word here is kid. She has, okay, okay, now let me do something about it. She has 4 kids. Okay, how would you make it better? She has 4 kids. Okay, this is
She
informal.
has 4 children.
Children is formal, right? So we'd be saying, instead of kids, we'd be saying children. Instead of said, we're going to use the clinical words. Lots would be converted to a lot of. So this is just a little list, and I would recommend that you copy this list and write it, put it in front of you where you write your letters, right? This is something that I needed you to know, because these are some words that you'll be using in your letter more often than usual. All right, any questions? Any
No.
questions?
No problem.
Not, let's move forward and let's do some sentences. Okay, this one's for you, Dr. Itcher. I would appreciate your attention regarding management of this patient. Okay, I'm saying
All right.
I I would really appreciate your attention. But there is an echo. Maybe it's because your mics are open. If you could turn them off. Like when you speak, when you're done with it, then turn them off. Okay, I would really appreciate your attention regarding this patient. Dr. Itcher, this one's for you. How would you correct it?
And really informal in here. That's why I will use highly instead of really.
Highly, or greatly, or you could say very much,
Yes.
right? You could say very much instead of these words, right? So really is informal. So this is a good one. But the next one's for you, Dr. Kiran. Are you there?
Yes.
Okay, so this one's for you. Um, Please do not hesitate to contact me if you need additional information. Okay, please do not hesitate to contact me if you need help. Yes.
The way you have
What's the
written you seems the you is not complete. Like it should be formal.
Okay, this is the one. Anything else? The rest of the sentence is fine. Please do not. There's a space in between in here and LESE. Right? Okay? Right?
Yes.
Okay, so these are some things. Right now, I'm sure that you guys can do this, so I'm just going to move to the next thing that we need to do, and that is learning how to
I
use or what can. Yes, yes,
I have a question. If we write
yes.
do not with a space between them, it would be counted as a single word or two words in our letter count,
2 words. Do not
word
is two
count.
words. It's 2 words, right?
Okay,
Cannot,
okay.
there are two. They're no one word, right? It is 2 words, right? Okay, yeah. All right, so don't be very fussy about it, but you know, I recommend that you write at least. I don't know when you guys have your exams, but if you have your exams like 10 to 20 days from now, you can at least write around 25 letters, right? And like 2 letters a day, so that you know you are able to understand that how many pages or how many lines do you use or consume while you write a letter, so that you can see the word count, right? So with the lines, you can understand how many words come up to this much of space, right? And use the official OET paper when you write letter. Should we move forward?
I have a question. Will we
Yes.
use space between do not, or shouldn't we use it?
What do you think?
I
What
think
do you think?
I think we would use the space.
Right? That's what I said. Use a space between do not.
Okay, and cannot would be without a space.
It depends on the English language literature they are following, but it can be together, right? It can be alone. However, I recommend that when you write cannot, you should write it together, right? So cannot can also be written like this, right? Cannot can also be written like this. Okay. However,
Okay,
I
thanks.
recommend that when you write it, you can write it like this. All right.
Okay, thanks.
Yes.
All right.
Okay.
Cannot, do not should would be alone. However, cannot should be used as one word. Okay. So now let's do this, right? These are certain acronyms which you can which you are supposed to open up, right? Because your English, because many of the acronyms are in Latin, right? So the OET examiners don't understand Latin, right? I'm sure we don't understand Latin either. So anything that you think is off of English, you should open them up, right? For example, your case notes would say ABDO, which would be abdomen. AC would be before meals. ADL would be daily activities in the daily life. You would not be writing end like this. You would be saying BD, which is twice a day, right? So here it is. Okay. This is your, I think I should call you guys again because my voice is echoing, right? So this is your SID, BID, TID, QID, right? So you'd open them to once a day, twice a day, thrice a day, 4 times a day, right? These are your acronyms there. You should not be writing tab, you would be writing tablet complete. You'd not be saying SYR, you'd be saying SYRUP syrup complete. Without should not be written like this. You'd open that up, right? Go through this list. It's really, really important, right? DOB. If you're writing it in the address, that's okay. You can write it like this. But if you're writing it in the letter, then you have to write it complete date of birth, right? Okay. ECG can be written as it is. CT scan can be written as it is. IV can be written as it is. However, if you are talking of doses, you might write it intravenously because IV is one word anyway, intravenous is one word anyway. So you can write it like that. All right. History should be written as history. L should be written as left. Okay. So this is some lift that I want you to go through, right? Okay. I'm sure you guys would understand it. Now, this is the thing here, right? Every time you come up on any disease, right? With the disease, for example, it's written hydronephrosis, right? We'll be doing 1 or 2 letters where there'll be word hydronephrosis and it's written question mark. What does that question mark signify? What does a question mark here in rheumatic fever mean? And what does a question mark here in
Diagnosis is not
hydronephrosis? Right, it's not confirmed, right? Probably, right? So when you'd
That
be
there
writing
is a
it in the letter,
doubt,
you'd say,
like a
yes.
provisional diagnosis is made.
Right, provisional diagnosis, or you could say probably, or you could use words suggestive. Do write these down, list them down, right? That what words can you use? Probably, suggestive, provisionally, right? Make a separate page and write these words there, right? Okay. So here is plus. What does plus mean? It could be meaning two things. That is either it's positive or it's increasing in quantity, right? Like you found nitrates on the midstream urine, and those were plus plus plus. It means abundant nitrates, right? Abundant nitrates on the urine. Okay, either it could mean positive or it could mean abundant. Right now, one more thing is, which is this. Right, this is this 252. What does this mean? 27 224 2/52.
2/7 means 2 days out of a week.
Okay. Who is this speaking?
Kiran, Dr. Kiran.
Okay. Okay, Dr. Kiran. Yes, 2 days out of a week. 224. Dr. Itcher, what would that be?
And I think it's hour, 2 hours.
2 hours after the 24 hours. Right? Okay. And 252, Dr. Zishan, what would that be?
Uh, Actually, I do not know.
Okay, that's all right. Any guesses? Any guesses? Because we're talking about time in here, right? This is 7 weeks, 2 weeks out of the 7 weeks, 2 weeks out of the 2 hours out of the 24 hours. What is this?
2 weeks out of 52 weeks.
Yes, 52 weeks, right? So don't get confused when this comes in your letter. This could also be like this 2 on 12. What would that mean? Dr. Saima.
Mm, maybe 12 weeks.
12 weeks. This is for weeks. This is for hours. This is for days. What is this for? 2 out of
Maybe
12.
for months.
Months, right? Months. Okay, so if you want to jot this down, you can jot this down that if they do like this, then it's days, right? If they do it like this, then it's hours, right? If they do it like this, then it's weeks, right? This would be your months. Okay, Claire, any questions in this?
No problem.
No? Should we move forward? I think it's really easy for you all, right? So the next thing that we're doing is using the titles. Now, my question is that when do you use the title Mr. or Mrs. for someone? Like, how old do you think that person should be when you use these titles?
Above 18, an
An,
adult.
an
18?
adult person.
Yeah, how would you define someone as adult? Yes, somebody said 18. Yes, Dr. Itcher, what are your views on that?
I think if they married, I'm doing like that.
If
If they
they're
married,
married.
yeah, married.
So unless somebody's married, they're not adults. That's a good thought. Okay, right. Dr. Zishan, what do you think?
Mrs. is for married and Mr. is for an adult who is
When do
18
you
and
give them
above.
the title? 18 and above. All right. Okay. All right. So before we move to this one, I want to tell you that when you're going to write dates in your letters, you should use one pattern for it. All right. Either you'd write like this or you would write like this, right? But whenever you're going to use months as months as in words, then you'd be writing complete months, right? You would not be writing incomplete months. And if you're using dots, please maintain the dot status quo, right? Okay, if you're using dashes, then you'd be using dashes throughout. Do you guys understand this? Okay, like try to keep the complete same pattern, right? If you're using slashes in the between, use slashes. If you're using words, use words, right? Just keep the same status of your letter, of your date writing. Okay, all right. So coming back to this, if you ask OET and if you ask anyone else, it's above the age of 16. Right? When somebody comes above the age of 16, that's when you start giving them titles, right? Okay, Claire? Is that clear?
Yes.
Right? Above the age of 16. Now, when would you call uh, a man Mr.,
You
right? When they are
you mean
above the age of
16
16?
and above
16
or
and above.
okay.
16 and above. Like as soon as you reach 16, the patient is a Mr. or a Mrs. or a Miss, depending on their marital status. However, let me make it really easy for you. Men, be it married, single, divorced, or childless, or whatever, they're always going to be a Mr. Right? No matter what their marital status is. When it comes to women, right, there is a tussle between Mrs. and Miss, right? This is your Miss, MISS. This is your Mrs., right? Okay. So when a woman is married, right, including a widow, right, including a widow, she's married or she's a widow, she's going to be called as Mrs. All right. When she's married or she's a widow, she'd be called as Mrs. She'll be called as Miss if she's both married or unmarried. Right? Do you guys understand? See, Mrs. is if even if she gets divorced, right? But widow would not be called Miss. Do you guys understand this? Miss is if she's married or unmarried. Mrs. is if she's married, if she's widowed. Widow would be not addressed as Miss. She'd always be addressed as Mrs. That is to give them honor, right? This date back to the old English culture. All right. Okay.
Okay.
All right. And when you're using specifically Miss, right? You're not using MS, but you're using Miss. This would be used for single and unmarried. Right? Single and unmarried. Okay, this is important because in your letters you'd be checked for it. In old days, they used to call the young children as masters, right? Young boys as masters, but now they don't do it because it's very fancy. All right, and it's very old fashioned, so they don't use it. Okay, also you would be not using Miss, you'd not be using master, you'd just be using Mr., Mrs., or Miss. Okay, clear? Should we move forward? All right. Okay, and every time you write the title, which is Dr., Mr., Mrs., you would put a dot after that, right? To show that this is an abbreviation for something. All right, so Dr., Mr., Mrs. All right, you'd be putting dot after that, right? Be clear about it. Also, when you're going to talk in titles, right? You'd be using their last name, right? For example, the name is Dr. Zishan Shah, so you'd be using Mr. Shah, right? Hafsawali, so you'd be using Wali. Okay, all right, clear? Should we move forward?
I
I
have a
thought
question. I
Yes.
have a
yes,
question.
Yeah.
yes, yes, please.
How about we will write about a child in the above opening introduction, like after regarding what we will write about a child.
You write their whole name.
Okay.
Okay, you'd write their whole name, or if you want to write, you can use their first name. Okay, all right,
Okay.
clear?
What will be the
Yes,
spelling of Miss? We will write MS or MISS.
Miss. This is what you write in your letter. I would not recommend that you write MISS or MASTER. Right? Okay, because this tells that the person is unmarried and single. Right? This is what it tells, that the person's marital status is single and unmarried. This is used for unmarried and married both. Why should we complicate ourselves by using this and remembering whether we should use it for unmarried or married or not? This is used for married and unmarried both, so let's use this. Right? So you'd be using Miss, Mrs., and Mr. for your letters. All right, should we move forward and talk about the comma?
Okay.
All right.
Okay.
Okay.
Ma'am, I have a question.
Yes.
In a letter, it was Amna Ahmed, 8 years old.
Mhm.
So, start we will write regarding Amna Ahmed, aged 8 years old, and in
Yes.
letter we will write Amna.
Yes. You can use the
Oh,
whole thing. You can use the whole name if you want to, but it takes your word counts and it just makes you write more. So it's better that you just use your first name, right? For
okay.
children. Okay, Claire?
Yes.
Any questions? Should we move forward?
No
If you
problem.
guys have any questions, you can ask right now. You can ask me later as well, but it's better because we're on the subject, so it's better you ask right now. Okay, one more thing. One more thing is that when you're writing the date, right? You're writing the age. So when you're saying the person is 28 years, right? If you're writing AGED colon, then you're writing 28 years old. All right? When you're writing AGE, then you're writing 28 dash or hyphen year hyphen old. There is no S in here. Okay? So when you write this in the paragraph of introduction, I recommend you write like this. Clear?
Yes,
Copy
no.
it down. It's important because you might forget it. Okay? Let's move forward. And when you're going to write yours sincerely, then you'd not put an apostrophe here, you just say yours. Okay, now let's move to the comma. Can you tell me when is a comma used? What is the purpose of this small punctuation mark? The dot who had a tail. It's one of the marks, it's one of the punctuation marks that puts you in trouble. And after dot, this is one of the most important ones that you use because there is nothing else that you use in your letter. Instead, this and the semicolon. Can anybody tell me the purpose?
When we are talking about a different thing in the
Mm-hmm.
same sentence.
Mm-hmm. Right? So you're saying that when you're using group of words, right?
Yes, but we are
Right?
talking
When
about
you're saying, mm-hmm. Yes, please continue.
we are talking about different sentence.
Yes, Dr. Zishan. Yes, Dr.
I
Zishan, please continue.
I was
Your
saying
voice
that
is
when
breaking.
we are using yes, when we are using uh we we are talking about a different thing in the same sentence. We use comma for that too.
That's great. That's great. When you're talking about the different thing in the same sentence, that's good. Right now, you see when you're using that, that's a good example. So when you're using the bunch of information, right, blue, green, yellow, and pink, right, this is when you use the comma. The comma is also used when you're trying to separate two pieces of information, right, two sets of information, right, and that is when you'd be using semicolon with it, right. You are writing two sets of information, blue and green, yellow and pink, right. These are two sets of information. If you want to separate them, use semicolon. Just wanted to tell you this, right. So do keep this in mind that these are two of the punctuation marks that you'd be using frequently in your letter. Now, talking about the more uses of comma, it can be used to tell a context of a thing, right. Context. It is used to signify the dates, right. Okay, it's used to put emphasis. All right, it is used to tell mood, right. It's used to do contrast. Okay, I'll tell you what it is. It's basically the same thing. For example, I'm saying today. I'm putting a comma here. So whatever follows this comma would describe what happened on this day, right? So when I put a comma here, I signify that the next of the lines or the next of the sentence before it ends with a dot would talk about this day only. All right, so this is what it says. It tells the context of the thing. Is this clear? Right? Okay. All right, instead, if I'm not saying today, I'm saying on
Yes.
examination, right? I'm saying on examination. Be wary of where you use commas, right? On examination, comma. So here, whatever examination you did, whatever you found there, that's what it signifies. Right, be careful when you use it because most of the times you'd be mixing up information. So this would tell you, this would be your own check that I'm going to write everything that I only saw on examination, nothing that the patient told me or nothing that was already found. This is something that you did and you found out, and the comma signifies, and that's what is the next signs are going to talk about the examination. Right, when you are trying to put emphasis on something, for example, please, right, then you put a comma. Right, when you're trying to talk of some mood, for example, unfortunately, right, or when you're saying gladly, right, right, when you're saying highly, highly, right. So when you're trying to put of a mood, if you're trying to put emphasis on something, that's when you use a comma. Now when you're trying to contrast of something, for example, you're saying that she had pain, however it was relieved. Now where you put the comma, you put the comma here after however, right. Okay, clear.
Yes, no
or
problem.
or here you or you end the sentence here and you say however it was relieved, right? So before you talk of the countries, that's where you put the commas. It's easy. You can go through the file and you understand the things. Just wanted to tell you that don't overdo it, right? Sometimes you guys underdo it, other times you overdo it. So just use it where you think it's appropriate. Otherwise, don't use it. Okay? So I'll give you one or two sentences, right? And I would want to see if you are able to put in commas. All right. Okay, which page is it on? It's on 28. Okay, this one's for you, Dr. Saima. On review today, Mr. Walker has reduced smoking from 20 to 10 cigarettes per day. What is incorrect here? Or where would you put the comma? Dr. Saima, are you there?
Yes, yes. On
Yes.
review today, there is comma. Mr. Walker has reduced smoking from 20 to 10 sticks cigarette per day.
That is great. You've become an expert. I'm sure you already knew it, but I have to say that, right? Okay, Dr. Zishan, on examination today, there was a soft fluctuant swelling palpable on the left cheek.
Uh, we would use on examination today, then there would be a comma. There was a soft fluctuant swelling palpable on the left cheek.
All right. Regrettably, she has problems with breastfeeding and caring for the baby. Dr. Etcher.
After regrettably, we should use
Right.
comma. Yeah.
Okay. All right. This one's for you, Dr. Kiran. Please note he has a prosthetic heart valve.
We will place comma right after please note, like please not, comma, and then we will write the sentence.
So you're saying like after please or after note?
After note.
Right, that's great. That's great. All right, so what is incorrect in this sentence? I'm writing to refer Mr. Jones, a 57-year-old man who was admitted to hospital on the 18th of July, diagnosed with myasthenia gravis. Where else should there be a comma? And what else is missing here?
There should be comma after Mr. Jones.
Okay. And
After man,
after man? Okay.
yes.
There's
And we should use I don't know that name, but and 57
Okay,
year
okay, you're
old.
right. Yes, you're right. But there would not be a comma after men. Because you know what you're doing here is that if you write, I'm writing to refer Mr. Jones, comma, because now when you put a comma, you're talking about this Mr. Jones and his age and everything that he has. You would not be putting a comma after men because you're continuing the sentence and you're saying that who was admitted to the hospital, unless it's someone else, unless it's another patient or you're talking about someone else, that's when you put a comma, right? Now that would signify that who is admitted to the hospital might be another person. But since you're talking about Mr. Jones, the thing continues, right? When you put a comma after 18th of July, that means that after that, it means that he was diagnosed on with myasthenia gravis on this particular date, right? Clear?
Okay. Okay.
All right. What about the second one? Mr. Jones, a 57-year-old man, was admitted to the hospital on the 18th of July, diagnosed with myasthenia gravis. Yeah. Where would you use comma here? Mr. Jones, a 57-year-old man, was diagnosed to hospital on the 18th of July, diagnosed with myasthenia gravis. Yes.
Again, I will say after old man, but I don't know exactly. I just read out of letter just like that because of this I'm saying.
Mm-hmm. So you think there should be a comma after men here? See,
Yes.
because we're not saying who here, so we'd use comma here. If it was written men who was admitted, then we might not have used a comma. But because we're not saying who here, we use a comma after men. Do you understand that?
Yes.
Okay, so who replaces the comma? All right. Okay. All right. So I'd be what I'd do is that now we're going to move to capitalization. All right. Okay. Let me just get back in here. Okay. Can you guys hear me?
Yes.
Yes, no problem.
Yes.
Okay. So now we're going to move to capitalization. Right. Can you guys hear me?
Yes, we
Yes.
can. Yes.
Okay, I apologize. Right. So now let's go to capitalization. Right. Where'd it go? Okay, so let's move to capitalization now, right? Now, what are the words that you can capitalize, right? That's what we're doing. Capitalization, right? So, which words do you think you can capitalize? For example, I'm saying the following are the words that you can capitalize, right? Do take care of it, right? This is really, really important. Now, I'm using following drugs, right? I'm saying that the patient uses these drugs. All right. Apologize for the wrong spelling, right? So, okay, all right. Okay, which one do you think out of these are generic and which one are brand names? Insulin is generic or brand name?
Insulin is generic name.
Generic.
Generic.
One is generic or brand name?
That's also generic name.
Metformin,
Generic.
Yeah, generic.
Generic.
Ryzek,
I think it's brand.
Brand.
I don't know.
Brand.
this one is
It's
also brand.
brand name.
Right, so every time you'd
Brand.
be using, right, so far is also brand
It's
name. So
brand.
every time you're using brand names, right, you would capitalize your first words. Brand names, you capitalize your first words. If you're using generic names, you use a small alphabets for them, right? Insulin would be a small I, right? Now, there is this one word which is cortisol, all right? One more thing, cortisol. What do you think this is? Generic or brand?
Generic name.
Now, what is it? Generic or brand?
That's the generic name, I think, not the brand.
It's brand name after putting R. Registered.
It is. Now, you see, sometimes in your letters, it would be like that they put R and they would actually give you a generic name. So, this is what you should treat like as a brand name, right? Because they tell you that this is an R and this is a registered word. So cortisol could be one of the drugs which is both generic and brand name. So that's where you give them priority over brand name rather than using a small c. All right.
Because R, right?
Yes, because of the R, because it now seems like that this is something registered, and you're going to use it as you're going to treat it as a brand name instead of a generic name. Now there are certain things where you can put capitalization, and there are some that you wouldn't put by capitalization. It whenever you're talking about diseases, right? Like cancer of colon, you would use small letters, right? Okay, when you're saying diabetes, you don't have to capitalize the D. When you're saying epilepsy, you don't have to capitalize the E. When you're saying myasthenia gravis, right, you don't have to capitalize the M, right? And when you're saying Parkinson's, right, if you're saying Apple, right, if you're saying Alzheimer's, that's when you capitalize it. Unless when it comes under the name of a discoverer, right? That's when you capitalize the diseases and their names, their first words, first letters. If not, then you'd be using lowercase words. Is that clear? Right?
Yes.
Clear? Okay.
Yes.
When you're saying the words X-ray, right? When you're saying the word X-ray, the X can be capital, it can be small depending on the case, right? When you're saying that a X-ray was ordered, cannot see the screen. Can you guys see the screen?
Yes.
Yes, I can see.
Okay. So, Dr. Karen, please readjust your router for Wi-Fi, right? So, okay, now you can. That's great. Okay, so X-ray can be written as both small and capital, depending on the situation. If I'm saying this is the X-ray of small intestine, that's when you'd use a capital X. If I'm saying an X-ray was ordered, because it's not specific, you'd use a small x. All right. But in both the cases, I'd recommend that if you are confused, you can use an X, which is capital, right? They don't mind. With an MRI, you'd be using MRI capital, CT scan capital. All right. PET scan capital. All right. Okay. When you're talking about the body parts, right, you'd be using small alphabets. You'd be saying leg, heart, right? You'd not be using heart with a capital H, right? When you're talking about the job
I
titles,
have
the
a
first,
question.
yes, please.
In the CT scan, we will write CT capital, right? Or the whole word CT scan.
No, just a CT capital, right? Scan would be small,
Thank you.
all right? In X-ray, you'd be writing the X capital, the ray would be small, all right? Okay. All right, so when you're talking about the job titles, for example, the janitor of school, right? So their first letters instead of the connectors would be capital, right? The first letter, the J, the S, they would be capital, right? When you're talking about institutions, right? For example, a Spirit Hospital, right? Spirit Hospital, then their first letter would be capital, right? The rest of it would be small. All right, clear? When you're using addresses, right, because you'd be writing addresses, the first letters are going to be capital, the rest of them are going to be small. Is this clear?
Yes.
When you're talking about the name of the someone, they'll be capital. If you're talking about some particular days which are of significance, you'd be using capital letters, right? For example, Christmas. If you're talking about months, right, they'll be capital, right? The first word, the first letter would be capital, right? Like you're writing 20th January 2021, right? First letters are going to be capital. Is that clear? Right? Clear to everybody?
Yes, clear, no problem.
Okay. All right, let's move forward and let's end this thing. Now we're going to move to difficult words. I'm sure we did complain versus complaint, right? I told you that complain was um, a verb and complaint was a noun, right? We did clear that out. Anybody has any questions in this? Clear? That when you use complaint and when you use complain, no questions here? Should we move forward?
Yeah, we can go on.
All right. So suggestion, recommend, right? Versus advice. Okay. Now I'm going to give you one sentence. I have suggested, I have suggested him to see you next week. Is this a correct sentence? I have suggested him to see you next week. Versus I have advised him to see you next week, right?
The first one is true, but after
Okay, this
suggest,
one's
yeah, we should use that.
that, right? After suggested, you're going to use that, right? So why is that, Dr. H? Are you reading the file or are you saying it from your own?
Sorry, I couldn't hear.
I'm saying you're saying it from your own, or are you looking into the file?
No, I don't have file.
Okay, that's great. You should have it, but still. So I have suggested that he see you next week, right? That's what you're saying would be correct here. That I have suggested that he see you next week instead of saying I suggested him to see you next week. Now the thing is, when you're using the word suggested, recommended, you cannot directly use the pronoun, right? You would not directly use the pronoun him, her, his, right? Instead, you'd be saying I have suggested to him, right? I have suggested to him, right? If you want to make this better, you would be saying I have suggested to him. But when you use advised, you can use pronoun directly after this word. Do you guys understand it? Is it clear? Because it's really important you understand it. Clear?
Yes.
Right? So I have suggested to him instead of saying I have suggested him. When you'd be using advice, you can directly use a pronoun after that. That's the same case with explain and tell, right? The words explain versus tell. I have explained to him. I have explained him. No, you can't say I have explained him, right? You'd be saying I have explained him. When you say I told him, this is fine. You can use pronoun after told, but you cannot use a pronoun directly after explain. You would be saying I have explained to him. You'd be using a connector in between. All right, clear? Conjunction.
Okay.
Clear? Any questions? You guys understand this?
Yes, no
Should we
problem.
move to the letters
Yes.
now?
Yes.
Should we move to the letters? Just one thing I want to say, the last one, which is widow versus widower. Which one do you think is feminine and which one do you think is masculine? Widow versus widower. Which one's used for which?
Wid- Widow is feminine, widower is masculine.
Right. Widow is for men. Widower is for women. Is that what you're saying?
No, widower is for men.
Yes, widower is for men and widow is for women. And widowed could be for both, right? Widowed could be for both, right? Widow is for female, right? Widower is for male, right? I hope you guys are not bored, but this is something that you need to know because you'd be using this in your letters, right? Claire?
Yes.
Okay.
Okay. Now, just one last bit. That is a few, right? Right versus few. A little versus little, right? So when you use a, right? When you use a few, what connotation does it give? Does it make you feel positive or it makes you feel negative, right? For example, I say that she has a very few friends. Is it a positive connotation or is it a negative connotation?
Negative.
Is it a positive connotation or negative? It's negative, right? However, when you use it in medicine, right? If I say she has a few problems, right? And I say she has few problems, or if I say that there are few ways to help the problem, right? I'm not saying there are a few, I'm saying few. There are a few ways we can help her. There are a few ways we can help her. In medicine, a few is mostly positive, right? It gives a positive sense, right? So why am I making you say this? I know it's very confusing, but when I say she has a few red blood cells, what does that sound in urine, right? It does it give a positive um, connotation or a negative connotation?
Positive.
Positive.
Positive, right? So you would not say you would say few red blood cells were found because you know this is a bad thing, right? Finding blood cells in urine, that is bad, right? So instead of saying, so whenever you're going to use a negative sense to something, you're going to say either few or little alone. But if you want to give it a positive touch, you'd be using a with it. Is it clear? Clear?
Yes.
Any questions? All right, so we're done with grammar for the day, and now we're going to move to the letters. You guys should go through the file. If you have any questions at all, you can definitely ask. Right now, let's move to the letters that I asked you to read. Did you guys read it yesterday?
Yes.
You guys did? That's great. So which letters did I ask you to do?
Sorry, I couldn't hear. Can you say this again?
Yes, I'm saying which letters did you guys read? Which letters did I ask you? I asked you to read the case on emergency liver abscess and pediatric case, right?
Yes,
Yes.
both of them.
Yes.
Right, you both read them. Right, so what we're going to do right now is, if you guys are not tired, we'd complete one letter, and then I would want you to write the next letter for tomorrow, right? However, if you want to save the rest of your letters, you can do that too. What I'd do is I'd give you guys yes, 5 minutes. But because you guys have read it already, I'll give you guys 3 minutes to just read the letter back on that of pediatrics, right? On page 14, you'd be reading that letter, right? You guys have 3 minutes to read that letter. Okay?
Yeah. I also write a letter for pediatric emergency.
You did?